also like to thank Central Represente and the Lawyers Committee for Civil Rights for your work in supporting these individuals and these families who came forward to tell their story. We've heard directly from these courageous individuals, predominantly immigrant women of color, who assert that their needs were not adequately met at the East Boston Neighborhood Health Center. Everyone deserves equitable treatment and access to that very, very highest standard of health care, especially our immigrant brothers and sisters and all those disproportionately impacted by health inequities. I stand in solidarity with former patients who are calling for accountability and better practices by the health center. And the health center does good work, right? We respect one another. They did good work during the COVID-19 pandemic. They just, as we all do, need to understand where we made mistakes and own up to it and be held accountable. They're calling for, and they, as in the families, are calling for better quality care of East Boston's Spanish-speaking population because that is simply what they deserve. In general, we must do everything we can to remedy the systemic inequities in healthcare that ultimately result in instances of malpractice, hospitalization, and even death in communities of color in comparison to white populations. Many come to Boston as a bastion of world-class healthcare. Many people make the journey to this country in search of everything that we have to offer: economic opportunities, housing, and yes, our healthcare. It's honestly devastating to think that some of these individuals were met with barriers to their health, and now it threatens their life. I stand with them and call for a reformation of treatment policies to provide better translation services, and that staff receive cultural competency training so that they can better service our neighbors. And thank you so much for telling your story and being so brave. Appreciate you all. Thank you.